Hi there, podcast and public radio fans. Heath Drusen here, host and creator of the Extremely American podcast. I'm working on season 3, which is an urgent story about neo-Nazi terrorists and how they helped build a modern white supremacist movement, even from prison. Some of their ideas have even made it to today's White House. It's both a gripping true crime story and a timely warning about threats to our democracy. And this time, my investigative reporting is funded by you. To support the project, please make a tax-deductible contribution at extremelyamerican.org. That's extremelyamerican.org. And thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Dr. Lauren Colson doesn't have a lot of free time. When he isn't treating patients at Full Circle Health in Boise, he serves as faculty for its residency program and at the Idaho College of Osteopathic Medicine. He's also on the board of the Idaho Academy of Family Physicians, is a founding member of the Idaho Coalition for Safe Healthcare, and spends more and more time advocating for women's health care since the Dobbs decision at the U.S. Supreme Court and Idaho's abortion ban went into effect. Well, this year, the Ada County Medical Society recognized Dr. Colson with their 2026 Notable Community Impact Award. And when the ACMS asked if we'd like to have him on the show to talk about his work, we of course said yes. Dr. Colson, welcome to the show. It's really nice to have you with us.
Hi, Gemma. Thank you so much for having me.
So, Dr. Colson, tell us about when you came to Idaho. Why did you pick the Gem State to practice medicine?
Yeah, so I went to medical school. I'm originally from Oregon, went to medical school in California, and I knew pretty early on that I wanted to do family medicine. Started looking at family medicine programs, knew I wanted to come back up to the Northwest, and was really looking for training that would offer me training with a diverse population and provide me with a broad spectrum skill set so that I could do everything from clinic to working in the hospital to doing OB. And when I checked out the residency program here, it really just fit the bill. It was a very strong program, is a very strong program, and allowed me to do all of those things, and all of that in an environment called FQHC, or Federally Qualified Health Center, working with those that need it most.
So, as I mentioned, you're a founding member of the Idaho Coalition for Safe Healthcare. Can you tell us about the organization? Can we start with that and what your organization does?
Yeah, absolutely. So just a little bit about my journey. Once I became a resident here, I had a growing interest in women's health care and OB care, reproductive care. And then when I started as faculty at the residency program, that was a lot of what I was involved in as far as teaching and a part of my own practice. And essentially what happened was the Dobbs decision in 2022, and we had some trigger laws in effect that happened almost immediately that folks are pretty aware of by now. And I, along with many of my colleagues, were really struggling on how to continue to practice reproductive medicine, obstetrics, gynecology under these new laws. And I was trying to figure out within my own organization, within the hospital, St. Alphonsus St. Luke's that I work at as well, and got plugged in with some folks that were trying to work on this and create some protocols and try and figure out under these new laws how we could adjust our practice so that we could stay within the legal bounds but still provide high quality health care. And that organization, that group of folks, was started by one of our maternal fetal medicine doctors at St. Luke's, Dr. Lauren Miller, who's unfortunately left the state since then, along with, at that time, about half of our maternal fetal medicine specialists that left under the same reasons of really struggling with how to practice under these new laws. And so myself and some other physicians and healthcare professionals got together and said, we have to continue this work. We want to stay here. We want to make healthcare safe. And most importantly, we wanted to take an issue that, is an incredibly hot topic, very partisan, and be able to talk about it
Hmm.
through the lens of medical expertise and talk with folks in the community, lawmakers, about how we can improve healthcare and talk about it and kind of try and take the temperature down a little bit on how we can all provide the best healthcare for Idahoans.
So you found Idaho Coalition for Safe Healthcare, and this includes the decision to file an amicus brief with the U.S. Supreme Court. Why did your coalition decide to take that step?
Yeah, thank you for asking that. Yeah, we're fortunate to have some, when we're broadened beyond just healthcare professionals, some legal professionals that helped us out with that amicus brief. And this was when essentially it went all the way to the Supreme Court of the United States, how to practice under this trigger ban, particularly around a law called EMTALA, the Emergency Medical Treatment and
Hmm.
Labor Act, where basically the federal government says if you're a facility, if you're a hospital that takes Medicare dollars, so you take federal dollars, you have to be able to provide stabilizing care in an emergency situation, regardless of someone's ability to pay. And that law was originally set up to keep hospitals from basically kicking to the curb folks that didn't have health insurance or couldn't pay for their care. But implicit in that was that if someone comes to your hospital in an emergency, and that is something like a pregnancy related emergency that may require ending that pregnancy, that you still have to provide that care, which is in direct conflict with our law. And so we really felt like we needed to highlight that and the struggles, because that was a big one of them, that our healthcare providers, our OB-GYNs, were having in making that decision when the federal law kind of was in conflict with our state laws.
So, are you concerned that things like contraceptives and IUDs, could be next to be banned potentially in Idaho?
Yeah, that's a good question. I think that is a concern. Of course, I think that we've set a little bit of a dangerous precedent here with making a law criminal to provide a type of medical care. That where does the buck stop? What types of care in the future could be criminalized? And we have that concern. And people have a wide range of beliefs, especially around things like contraception, as far as if they have any moral conflicts with providing contraception, which is a type of healthcare that we provide, often known as birth
Hmm.
control, to prevent people from getting pregnant. And it's one of those things that when we start legislating medical care based on personal beliefs and moral beliefs, and not necessarily what people's individual beliefs are, and I feel very strongly that healthcare should be between a healthcare provider and the patient, that we're not able to have those individualized decisions anymore, and creating blanket laws such as something that could criminalize contraception is something that scares us, because that takes away another thing that we're able to talk with our patients about and provide them with the ability to be in charge of their own health.
Hmm. So the coalition published a report on the impact of physicians to Idaho's economy, and the report says that for every physician, more than, I believe, $1 million annually is generated in downstream services. Can you talk to us about how physicians generate revenue for communities here in Idaho? And will there be an economic impact when you add doctors or even when you lose doctors from our state?
Yeah, I'd like to color that in first by another report that we were able to publish along with the Idaho Physician Wellbeing Collaborative, that reported that we were losing a lot of doctors. Either they were leaving the state or stopped practicing, and that resulted in us finding that about 35% of our OB-GYNs were either, again, not practicing or had left the state, which then subsequently resulted in labor and delivery units shutting down, and communities really losing a lot of access to their medical care. And then with this report that you're mentioning, I think that highlights that when you lose a physician in a community, you lose, especially in my case, a family doctor, you don't just lose
Hmm.
someone that's able to deliver babies and manage a labor and delivery unit, but you lose someone that admits people to the hospital who are sick inpatient for other reasons. You lose someone that is providing clinical care in the outpatient setting. And so that creates not only a healthcare desert or a place where people can't get medical care without traveling a further distance, but yes, a large economic impact as well when you don't have folks that can manage those different settings in the hospital and outside.
You are a leader in women's healthcare initiatives across Idaho, and you are also a male physician. What motivates you to have become such a champion for women's health?
Yeah, I spent a lot of time in a women-dominated area, talking with women healthcare professionals and other leaders and champions in the community who are women. And I would say, kind of going back to my original training, I think because I was a male doctor, especially when I was in medical school, I didn't get a lot of female patients because I think that folks tend to self-select out if they're female, seeing a female provider, if they're male, seeing a male provider, and it wasn't until I got to residency that I got to again do more women's health care and really found a passion for it. And it was really an area of medicine, even though I knew I wanted to do family medicine earlier on, that I hadn't really been exposed to the extent that I had been until I got here. And so it became a passion of mine. And then again, when things drastically changed, I just really felt that I had a responsibility to take care of that. And I think that we all know this isn't an issue about women. This is an issue for
Hmm.
everyone and everyone's healthcare. And I don't think that we can divide ourselves along gender lines as far as this being a healthcare issue for only half of the population.
Before I let you go, a few years ago, I believe it was 2023, you and your organization were concerned about the legislature's decision to let the Maternal Mortality Review Committee here in Idaho expire. Can you talk to us about what has happened since then?
Yes. So basically, we were one of the last states to adopt a maternal mortality review committee nationally. And we had another OB, Dr. Amelia Huntsberger, who has also since left the state due to our laws, who really felt, I believe, I think it was in 2019 that we needed to establish a maternal mortality review committee, and the legislature at that time recognized that need and passed a law, but passed it with a sunset date. Um, and so then in the midst of Dobbs happening, we were getting over COVID. There were a lot of kind of healthcare issues going on. It was brought up to the legislature that needed to be renewed. Otherwise, it was going to sunset. And I think I know, and again, I don't quite know all the things that were happening behind the scene, but for one
Hmm.
reason or another, it didn't come to fruition. A bill didn't pass that session that allowed for the continuation of the Maternal Mortality Review Committee. And so at this time, when we had massive changes to how we were providing obstetrical care in the state, both by the laws and by a lot of these labor and delivery units shutting down and less OB care being available, all of a sudden we weren't able to collect the data anymore on maternal mortality or deaths that were related to pregnancy in the state. And so I think that was incredibly alarming to us who provide OB care, because we want to be able to review cases where there was a poor outcome and see how we can do better in the future. And so we were in the dark there for a while. And fortunately, it got recreated. It's under, it used to be under the Idaho Department of Health and Welfare. It's now under, uh, uh, I'm forgetting exactly, it's DOPL. It's uh, the Department of Occupation and Professional Licensing, I believe.
Hmm.
And so it's been recreated. It's put out some reports now, but it's a new group of folks. That there were different people that were on that committee before, and so I think it's been a steep learning curve, both for that new department to be handling the Maternal Mortality Review Committee and for those members that are on that committee as well.
Well, I want to thank you so very much, first off, for the work you do and for spending time with us today. We've been speaking with Dr. Lauren Colson with Full Circle Health. He is the Ada County Medical Society. They recently recognized him with their 2026 Notable Community Impact Award. And thanks so much for listening to Idaho Matters from Boise State Public Radio. Do you have thoughts about today's episode? Make sure you email us at idahomatters@boisestate.edu or reach out on our socials. Just by listening, you're helping to support public radio right here in Idaho. And I want to say a big thank you for that.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.